Great, guys. So let's start. I mean, this is not a class. This is just the introduction about the course and the induction, formal beginning of the course. We usually say that, right? I'm good, Aftab. I'm good. So I hope you all are doing well, and let's discuss about the course. I want to know a few more things from you also, and I want to talk about the course as well, and would discuss about the syllabus, what we are going to discuss in the next 8 to 10 classes. Okay. Okay, so yes, guys. So as you all know, this is the fourth and last series. Okay, proudly, this is the fourth and the last series of pre-med cardiology series. Okay, and this course, the entire master course, was done in collaboration with WIHF, World Youth Heart Federation India. So I'm thankful to WIHF for giving us this specific authority or the permissions to conduct this course with them. And I would like to thank all of you who are associated with this course and who are witnessing CLIMAD's first master's course getting completed. Okay, you are witnessing our first master course, which is completing now, which is having our last series in that. So you will be getting our first master's course certificates, you all. Okay, other than that, there are multiple things going. In gastroenterology, we have a master's course in our oncology. So you will see like how we are coming up with this cardiology series and how we are completing. So first session I remember, first course I remember, of this series, it was on the basics, basic diseases of cardiology, right? And then second series was on arrhythmias, right? And the third series we have recently completed, that was on pediatric cardiology. And then I thought like, okay, let's end this at least, end this series now. So I asked you multiple times like what you want to learn. I asked every one of our students, our participants. So you guys chose like, okay, you want to learn about the drugs. You guys want to learn about the pharmacotherapy of the cardiac drugs. So this series is basically focusing on cardiac pharmacotherapy, right? And as you know, there are multiple drugs. I would like to ask you also, first, what I thought is, I'll be completing, the major cardiac therapies in, around 6 to 8 classes, including the antiplatelet drugs, anti-hyperlipidemic drugs, which are very, majorly important. Antiplatelet drugs and anti-hyperlipidemic drugs are, main cause of what we say the heart attack or myocardial infarctions, right? And, used in ACS patients or coronary artery disease patients. We call it with the different names, either ACS, CAD, or heart attack, or MI kuch bhi. But we are having these major drugs, statins and antiplatelet drugs. So we must know about everything. Okay, everything about antiplatelet drugs and anti-hyperlipidemic drugs, including what are the classes, what are the drug names, what are the doses, especially what are the drugs in practice right now, what are their side effects, what are their contraindications, everything, right? So those everything will be covered here. Okay, that everything will be covered here. And then I'll be talking about some very specific drugs related to hypertension, like vasopressors and all the antihypertensive drugs. I mean, including diuretics, including your ACE inhibitors, beta blockers, every antihypertensive drug, calcium channel blockers, central symptomatics, inhibitors, everything. And then the major thing what we usually look when we are looking into the cardiology, we look at the heart failure. So definitely vasopressors, inotropes, and drugs for heart failure, and the treatment for heart failure also will be talking about, okay, in details. And then the major part, another major disease what we usually see in the cardiology, adult cardiology, that is anti-arrhythmic drugs. Okay, so we'll be talking about anti-arrhythmic drugs also. So till now we have around 6 classes. Okay, till now we have around 6 classes, and rest I left to you guys. Okay, you guys have to decide what other 2 or 3 topics you want me to cover. So you can tell me now or in the group, wherever, whenever you want. I will add those 2 or 3 topics of the drugs, 2 or 3 therapies, and then I'll be explaining all to you. Okay, so I left 2 or 3 classes, totally up to you. Whatever you want to learn, you tell me. Okay, otherwise I will be having an option. I'll be having multiple options actually with me. So but that I want you all to choose what you want to learn in the cardiac pharmacotherapy additional 2 or 3 classes. Okay, now very important and specific thing what I wanted to talk to you is about the certificates and master's course certificate. Okay, one thing, whoever has completed all the 4 series and passed the exam for all the 4 series will get the master's certificate. Okay, whoever has cleared series 1, series 2, series 3, and this upcoming series 4 with the whatever the mark criteria is there, whatever the marks criteria is there, will get the master's certificate. Okay, now the question is, many of you haven't attended the previous series like series 1, series 2, or series 3. So for them, we are coming up with the solutions that once this cardio series 4 is completed, or just before the completion of cardiac series 4, we will be launching cardio series 1, 2, and 3 all again. Okay, recorded based, self-paced course. Okay, self-paced course of cardio 1, cardio 2, and cardio 3. I'm not going to take the classes again, for 10, 15, or 20 people, literally, because there are a lot other things to cover, and I'm definitely very soon I'll be declaring one more course what I'm right now studying and getting the training of. Okay, so that you have to whoever has left any of the series, either type, series 1, series 2, or series 3, whatever, you can just go and check out, and you can just register and complete the self-paced videos, and after that you all will have exams. Okay, exams will not be like quiz. Okay, exams will be done like on the given date with the given format only, whatever it was there, and all the new questions. Okay, and those exams will be only once for cardio 1, cardio 2, and cardio 3. Remember, guys. So keep it in mind whenever I'm telling about first 3 series, we will launch it again self-paced. You have to complete that. You have to complete the registration process, and you have to complete those series at the self-paced, and then you have to clear the exam. Okay, once you clear the exam, then definitely you will be eligible to get the master certificate. So no worries if you have left any of the series, any of the previous series, you can get into the course, you can complete those series, and you can get the certificate, master certificate. And if you don't want to complete the master certificate, anyways, each series have their own certificate, have its own certificate, right? So series 1, you got the certificate, series 2, you got the certificate, series 3, you got the certificate, and series 4 also you'll be getting the individual certificate. No worries about that, right? No worries about that. You will be getting the certificate of series 4 as well. But if you want to complete the master's course, then you have to complete all the series. Okay, all the series, and most probably in the November month, in the month of November, we will be giving the master certificate, right? Because in next 8 to 10 weeks, I'll be covering the series 4. I'll be covering the series 4, and then we'll be giving a month of time to complete all the series with exams and all, and then master certificate will be distributed in the month of November of this year, right? Right, guys. So that's it about the course and the certificate. So remember that the cardio 3, as in the cardio 3, we did one what we say only one exam attempt cardio 4 also will be having only one attempt. Okay, cardio 4 also will be having only one attempt. And I really don't mind if you are coming up with a lot of requests, if you are coming up with a lot of excuses. I won't consider anything. You know why I'm telling it? I'm declaring it right away. In the first class, in the induction class, in the introduction, you have to take it serious. Whenever I am asking or anyone is asking from my team, like when you want the certificate exam, you choose it carefully, and whatever will be the majority, okay, based on the majority we will be, you know, conducting the exam. See, I'm not deciding the dates will be decided by you, time will be decided by you, not by me or my team. Okay, it is completely up to you. So choose the dates. At the end we will be giving you the options, 3-4 options. Choose the options correctly, and you know, get the correct date wherever you can attempt, and make sure that you are available on that date to get the certificate exam. Okay, so that's why I'm telling you guys, exam will be done only once, only one attempt will be there, right? So try to do in the once only, right? And then along with that, I mean, I'll be teaching everything about the course. So let me share once the brochure with all of you. So this is about the course. We will be talking about all drugs, drug categories, classification, indication, mechanism of action, side effects, monitoring, and contraindications, etc. And this. Okay, so I just want to know that is the time okay if I take the classes every Tuesday from 7 to 8:15 p.m. Is it okay? Usually my classes are from 7 only. So is this time okay, or shall I go a little later or little earlier? Yes guys, please tell me. It's okay. 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 So your classes will be, as everyone is saying, I think. No, sir, on Tuesday we have class of research paper writing. Research paper writing is only today and next week. Then research paper writing will be completed. Okay. Then research paper writing will be completed. There is no more classes of research paper writing. Research paper writings only 2 Tuesdays. One will be starting at 7 today, and next we will sift it out, or we will see how we are conducting that class. Okay, we'll definitely make sure that these are not clashing, and if these are clashing, these will be on different platforms. So you can prefer one with the recordings, but I'll make sure that these are not clashing, because both the courses are very important for all of us, right? All of you. Don't worry, Aftab, don't worry about those things. So fine. Okay guys, so I hope everyone is clear with that. Now you can come up with your questions, and you can ask me if you have any kind of questions to me. Yes guys. So I will again say, encourage, if your friends, if your colleagues, anyone wants to join this course, they can definitely join. They can complete the course on self-paced, the previous one, and this they can even join live now, because technically the classes will be starting from the next Tuesday, from the 8th, right? From the 8th. And I think okay, so classes will not be starting from the 8th. Okay, classes will not be starting from the 8th. Why I'm telling this is because 8th I'll be traveling to Bhopal. I'll be in the, definitely I have the flight at this time. So 8th I'll see if I can take on 8th or 9th, but that week only will take the class. Okay, and timings will be the similar. Okay, so 8th I'll not be taking the class for sure, because 8th is my flight. I'm just seeing in my calendar. So 8th will not be the class. Okay. How the exam will be conducted? We usually conduct the exam in the MCQ format. Definitely this time also for cardio 4 also, we'll be conducting the MCQs. Okay, we'll be conducting the exam in the MCQs form, and there'll be 20 or 25 MCQs, and time will be decided that time only. We usually give enough time, an hour time. Okay, so don't worry about that. MCQs, all about MCQs, don't worry. Through the Google form. Sir, we have separate exam for master certificate, or do we get the automatic after completing? No, automatic after completing the 4 series. No need to go for the master certificate course exam. You don't have to give the extra exam for master certificate. Whoever is completing all 4 series, whoever is passing all 4 series will get the master certificate automatically. No need to do anything else. Okay. There is nothing, no specific exam. Exam marks and all thing will be decided that time only. Usually you have to pass the exam with 60% marks. Okay, usually you have to pass the exam with 60% marks. So 60% marks means if it is 100 marks, usually we keep the question paper of 100 marks only, including like 25 questions of 4 marks each, and then you have to complete the exam with at least 16 or 17 correct questions out of 25. Okay. Yes, we are teaching the mechanism of action of the the drugs and the drug courses. Don't worry about that. I'll be teaching myself everything, so don't worry about that. I'll be teaching all those things, mechanism of action and everything. Yes. Where can we do fellowship after Farm D? So in India, I believe there is only one place where you can do right now, that is Parul University. But very soon, guys, very soon, I have a very good news for you. We'll be coming up with a fellowship in collaboration with one of the one of the top institutions in India, one of the top hospitals in India. We are coming up with our cardiology fellowship very, very soon. Okay, but that will be restricted to 4 or 5 or maximum 10 seats, not more than that. Girizamma, I think I just told about the series 1, 2, and 3 that we are going to conduct the series again before we are finishing the cardio series 4. We will be launching 1, 2, and 3 again with the recordings, with the self-paced learning, and you have to complete those. You have to register and complete those series on the self-paced, and then your exam will be conducted. You have to clear the exam, and then you will be eligible to get the master's certificate. We are definitely, Hina Firdaus, we are giving the recordings of all the classes, and from now onwards, guys, for your information and for your friends also who couldn't join due to any reason, all the classes will be freely available to everyone. Okay, since we are starting this course, series 4, even the series 1, 2, and 3, all the classes, or maybe I'll be recording again the classes, all the classes will be open for all. Anyone can come to our YouTube channel, anyone can learn from there. If you want the certificate, you have to register. If you don't want the certificate, come and learn free of cost from our YouTube channel. All the classes will be free of cost available on our YouTube channel. Okay, all the classes of cardio, for sure, that we have decided that all the classes will be freely available for everyone on our YouTube channel after the class. Anyone can learn from there. Hope the course will cover limitations of current cardioprotective drugs. Okay, so guys, you think I'm giving you the time, okay, time of almost 1.5 months or maybe 2 months, because in next 1.5 months only I'll be covering the 6 classes. Okay, so 1.5 months, you think of like what you want to what you want me to teach additionally in our upcoming classes, in our last 2 classes or 3 classes additionally. Okay, that's up to you. You cardioprotective drugs or whatever drugs you will tell me, I'll be teaching you. Okay, yes, that will be there. So sir, do we have to pay for that? Pay for what, Prajakta? I didn't get your question. Dose calculations, there are no dose calculations in cardiology, guys. In the cardiology, only few drugs needs the dose calculation. Those I'll be telling, and not exactly the dose calculation, but dose adjustment in in case of renal failure or in case of certain other problems. In that, those things I'll be telling. Definitely I'll be telling. I'll be covering that. Those calculations are there only for inotropes and some, intrabolus drugs. That's not a big deal. We will also get this individual certificate for series 4. Yes, absolutely. Everyone will get the individual certificate for each series. Okay, for each series, and at the end you will be getting one master course certificate which will be mentioning about all 4 series. Okay, with the titles and how many hours did you read, and about almost all the details which should be there in the certificate. Master's course certificate will be is going to be very amazing, don't worry. Yes, I'm coming up with multiple things in cardiology. Cardiology is not just what we learned in the master's cardio series. I mean, we have covered few important topics, but the entire cardiology will never be covered, because there are a lot of things which are coming up, and there are a lot of topics which are out of your practice also, out of your scope also right now. So I just covered whatever is needed for you in this master's course. Okay, will be individual certificates. Yes, definitely. You will get this individual certificates. Drug interactions will be done. Yes. For series 1, 2, 3, if you are looking, no, see, whoever has completed series 1, 2, 3 already, they don't have to pay anything, and they don't have to go for exam because they have already cleared. But who has just admitted to the course, this course series 4 only, and they did not attend course series 1, 2 or 3, they have to pay. Definitely they have to pay the fees, whatever was there, whatever will be defined. They have to complete the series, they have to get the exam, they have to get the individual certificate, and then only they will get the master's course certificate. So whoever is joining series 1, 2, 3, they have to pay for that. Definitely, because all the people who are now in the series 4 and who has completed 1, 2, 3, they have paid for that, right? Yes, treatment algorithm will be there. Okay, so I think that's over. Yes, you will get the certificate only if you are clearing the exam. Clear, crystal clear. If you're not clearing the exam, nobody will get the certificate. Attendance criteria is not there. I don't keep attendance criteria. You can come to the class, you can not come to the class, you can read from the recorded classes. I don't mind, but I always prefer, if you are there in the class, you will be clearing your doubts with me. Okay, in my cardiology series, there is no attendance criteria. If one person will come, I'll teach that one person also. Okay, but you all have to pass the exam at the end. You all have to clear, all have to watch that. Okay, all have to watch the series. See, attendance criteria, I'm talking about live attendance. It's not mandatory, but it is mandatory to watch the video afterwards. If you are not watching the video, if your attendance is going less than 75%, then definitely you are not getting into the final exam. Okay, so it is up to you if you are coming live in the class or if you are watching the recordings. It is totally up to you. I don't mind. Okay, so live class, no attendance criteria, but attendance criteria is there in the watching of videos, because we have the perfect analytical team and perfect analysis team. They check all the Google Analytics, and they can get whoever has attended, whoever has checked the classes or not. Yes, we'll be talking about the algorithms, treatment guidelines. Yes, single attempt of exam. Yes, classes only on Tuesdays right now. I mean on Tuesdays 7 to 8:30 or 8:15. Payment link will send. Series 1, 2, 3 we will launch. Don't worry, we'll launch. Don't worry, I just told we'll launch it at the end of the series 4, or just a week or 2 weeks before the series 4. Okay, see, first let the class complete, then you will get the recorded video. No? After each and every class you will get the recorded video. Okay, so guys, thank you and take care. Okay, and I think okay, I think that's all for today, and we can meet you next time whenever the next class is. You can encourage your friends if they want to join this course. Okay, I hope it's clear, and I'll be sharing the recordings as well after an hour or after 2 hours, so you can check out those videos and you can just clear that things. Okay, you can just get it, get it, you can watch it again and see if you missed anything. Okay, Take care, guys. Thank you, and we'll see you in the next class.